we are here right now with Dr. Jonathan Tarbox. Always so thrilling to have you here on Fridays at 11 o'clock. You are the director of
Research and Development at the Center for Autism and Related Disorders.
It's a mouthful for me, so I'm glad you jumped in and helped me.
And the Executive Director of Autism Research Group.
Okay, wonderful. And we're going to talk all about more of that in just a minute. But we had a question earlier in the week that I wanted to have you weigh in on, because we've had several people ask it in several different ways.
Sure.
When our children are really interested in playing with and heavily reinforced by things that are no longer age appropriate.
Mm-hmm.
The example that somebody had written in about was a 10-year-old, I believe, who is still really into Baby Einstein. And we've had other parents write in and say, you know, that age with, you know, things like Thomas the Tank or the Disney sing-along videos, a lot of kids are really obsessed with, and it gets to a point where it's no longer productive, but it's the thing that's been reinforcing.
Right.
We want to hang on to things that are reinforcing, but how do we get them to age appropriate? So I know you're the man on these kinds of things. Help us out here.
I'm not sure about that, but I'll do my best. So that can be a really tricky thing to deal with. You know, as a behavior analyst, the very first thing that we're always concerned with, pardon me, is having effective reinforcement. And so that's the number one thing, right? Like which reinforcers are going to be effective. And the thing that matters the most with that is what the kid cares about, not necessarily what you care about or what anybody else cares about. So that's priority one. However, as you say, that does, if you only focus on that, then that does get kind of socially inappropriate or age inappropriate sometimes. I mean, frankly, a lot of the kids we work with would rather just eat M&Ms all day for all their reinforcers. We're not going to do that just because that's a favorite thing. So there has to be some limits, right? Of course. Due to nutrition, age appropriateness, social context, culture, religion, you name it. All these factors impact which reinforcers you select. You know, I guess what I would say is, you know, you should ask yourself a common sense, or I don't know if it's common sense is the right word, but sort of practical question of what difference is it really making to the kid that thing that he likes that's age inappropriate, how much of it is about the fact that you are not happy with him doing something age inappropriate versus how much is it really actually impacting his life. So for example, if a 10-year-old is, you know, going on the playground talking to his peers about Baby Einstein, that's going to be a disaster socially, right? That will literally exclude him from social interactions. However, if a 10-year-old, you know, just worked really hard on his homework for an hour and now has 10 minutes of video time alone in his room and he chooses to watch Baby Einstein, is that really a big deal? I mean, is it having an impact on his life? Maybe, you know, wouldn't it be better if he was doing something that's more age appropriate? Sure. But is it really having a negative impact right then in that controlled setting with no one else watching? Not really. Who cares? So, you know, that's sort of the first question to ask. And usually it's not that black and white. Usually there's some more gray area. I was just going to say, I don't know, because I'm always trying to think into the future. And if it's okay now, but what happens? So thank you for saying it's not always that black and white. Yeah, so it's not always that black and white. And then so sort of the next thing you can try to do is come up with some variation on the theme that your child really cares about, where that variation is a little bit more age appropriate. So if there's a particular, you know, character that the kid really likes and he's doing wood frame puzzles, which are for babies, well, maybe work on writing, you know, stories, you know, having the child write stories on a similar topic, or, you know, drawing and painting pictures on a sort of similar topic, you know, something where the activity itself is more age appropriate, but still kind of references the theme or the topic that the child really enjoys. But yeah, it is challenging.
Yeah, it is. And I was trying to think in terms of, because some of the Baby Einstein videos have toys in them. And some of them are baby toys, but some of them aren't. And seeing about maybe getting some of the toys from the video that aren't, like there's one in particular that I remember, because it seemed like it played in my house for 7 years. It wasn't, but it seemed like it. There was one in particular that's that sort of, it defies gravity, the little wheel that goes around the
I know exactly what you're talking about,
that, you know, that might be a thing to give as a reinforcement so that it has the connection between the thing, but it's hard because a lot of the toys in it are baby toys.
Yeah. You know, another thing to ask yourself is, how much is this really critical reinforcer to use for my child's education and therapy versus how much is it just something that they're really obsessed with and they like to do all the time?
Oh,
you know,
okay.
so if you have really powerful, effective reinforcers, and there are other things that the child will, you know, do in their leisure time, even if it's not their very favorite thing, then maybe it's not the end of the world to gradually reduce the amount of contact that the child has with this thing that they're really obsessed with that's age inappropriate. So for example, you know, if you have 5 or 10 different types of reinforcers that your child's earning during education or therapy, and the thing they're really obsessed with, Baby Einstein, is one of them, or is maybe even their favorite one, as long as you have lots of other effective motivators, it's probably not the end of the world to gradually decrease.
Okay.
And you know, the other thing too is, sometimes folks feel like, well, it's either all or nothing. So either I sit my kid in front of Baby Einstein 3 hours a day, or we have to throw them all in the trash.
Right.
Well, that's not a real choice. That's an artificial choice. You can decrease the amount of time. So now maybe instead of an hour every evening in front of Baby Einstein, we could start with, you know, 50 minutes, then the next week 40 minutes, the next week 30 minutes, while also introducing other things, many other things that hopefully your child will catch on to and enjoy also, while gradually decreasing the thing that's age inappropriate.
And so no cold turkey. We don't have to do cold turkey.
You can if you want to, yeah, but and it's, I guess, easier conceptually, right? Because you know exactly what to do. No more X, you know what I mean?
Yeah, but
that's going to be tougher on, it's going to be tougher on the kid. And if it really genuinely is something that the kid's really obsessed with and really, really loves, that is going to be kind of rough to suddenly just have it, you know, not have it the next day. And, you know, especially, you know, the kid might miss it, you know, genuinely miss it. And, you know, separate from maybe having challenging behavior or tantrums or something else, they might genuinely feel sad, you know?
Yeah.
And there's no, I mean, sometimes that's part of learning and growing up is feeling sad, but we don't need to make our kids feel sad when it's unnecessary. So maybe a more gradual approach is good. But be careful with that, though. That doesn't mean negotiate or bargain. That doesn't mean, you know, feeling tired. I know myself. I know parents. You know, it doesn't mean getting tired and sliding back because you just don't want to deal with it. It means just being gradual and systematic.
Okay, wonderful. And somebody's writing in saying, thank you for these questions about Baby Einstein. See, I didn't forget that you asked this. It's about how much perseveration, thank you, borrowing these lips. It's about how much perseveration is okay. Is that reward of perseverating like watching YouTube John Mayer audience applause repeatedly over and over, and okay for how long is it appropriate?
Yeah, great question.
Did you get the
and so
gist of that?
I do, yeah. And so basically the issue here is if I let my child perseverate too much on a particular topic, am I sort of encouraging perseveration on that topic in general, right? So honestly, there really isn't enough research on that for us to know for sure. There have been a couple studies, though, that have shown if you use children's obsessions as rewards for working, so you use things that they really perseverate on as reinforcers, and or you allow them to engage in stereotypy or perseveration as reinforcement in itself, there are a couple studies showing that doesn't increase perseveration outside of those sessions. But it's really preliminary, just a couple studies, and there really needs to be more research on that.
But actually, you know, it's interesting that you should bring that up because I was in a discussion with some parents the other day in which we were talking about that very thing, and a couple of different moms were saying, and I thought, oh, I haven't really thought about this in a long time, but my son makes high-pitched noises, still does. That's his sort of stimmy thing that he does. And it got to a manageable place when we were able to say to him, this is when you're allowed to do it, and then stim your face off.
Right.
But the rest of the time, here are the places that it isn't appropriate.
And as long as there's very clear cues about what makes it appropriate or inappropriate, for example, in your room by yourself with no one able to hear it, not a big deal, then yeah, there's no reason to think that that's going to encourage him to then do it more outside of those circumstances. We actually
saw it reduce in the other places.
You just need to be clear about when it can happen and when it can't.
And it became more effective when he was doing it inappropriately. If we would call it his attention, he became much better at self-regulating and going, oh, you know, okay, I'm not doing that. He seemed to have much more control over it when it had an appropriate outlet. Okay, and I think this is in addition to this, they said we never grew up being able to repeat our favorite parts of programs. How is this ability to repeat electronics enabled, and how electronics enabled these perseverations? Because when we were kids, we couldn't go back. I remember being able to watch Wizard of Oz once a year. It came along, and man, everybody had to be quiet so you could watch Wizard of Oz, and now kids can see it 30 times in one afternoon. I wonder how much
and especially something like YouTube is just so rapid. You can watch the same thing over and over 100 times in an hour.
Yeah, absolutely.
Again, it may well be encouraging that behavior, but as long as you bring that behavior under appropriate sort of control of appropriate context, so here's when it's okay to do it, and here's all these other times when it's not okay to do it, it shouldn't matter too much. I mean, again, not enough research on that, but clinically I know, and I've talked to many colleagues who say, yeah, this works. There just has to be clear cues. In fact, some people use bracelets, like there's two different colored bracelets. If you're wearing a green bracelet, you get to do whatever the stereotypy is. If you're wearing the red bracelet, you don't. And so you just swap the bracelets on and off. So that's an option too. But a lot of times it's easier to just do more clear environmental cues, like in your bedroom by yourself. Big deal.
I started to laugh because the other day my son wanted popcorn, and I said, I don't want to get popcorn because then I'm going to eat it.
Right.
And he said, Mom, here's what we're going to do. This is literally what he said to me. We're going to put a rubber band around your wrist, and every time you think you're going to eat the popcorn, I want you to snap it. And I said to him, Where have you heard this? He saw it on some show.
That's funny.
Saw it on some show. That was immediate. I said, where have you gotten that from? Because we never did anything even remotely like that. He's like, this is how we're going to combat this, Mom. From my 9-year-old. Gotta love that.